Chapter 5, Recording 2. Now that we've put words together, let's take them apart. So we have to begin with the suffix and work backwards. The term contains a prefix to find the suffix, find the prefix, and then find the root word. So here's some examples. So neuropathy, let's break it down. Let's pull pathy out. It's a suffix meaning disease. O is the combining form. Nepher is the word root meaning kidney. So nephropathy means disease of the kidney. Dysuria. IA is a suffix meaning condition of. Dys is the prefix word meaning difficult, painful, or abnormal. Ur is the word root meaning urine. So dysuria means painful urination or difficulty urinating. Hyperemesis. Hyper is a prefix word meaning excessive. Emesis is the word root meaning vomiting. So hyperemesis is excess vomiting. Analgesic. Ik is a suffix meaning pertaining to. An is without or absence of. Alges is a word root meaning pain. So analgesic is pertaining to no pain. So when we give an analgesic, which is a type of medication, it's to reduce the patient's pain. Abbreviations, acronyms, and symbols. Medical abbreviations, acronyms, and symbols are a type of shorthand used for communication. It's developed because one could communicate faster using this method. It's important not to trade speed for accuracy and use only commonly understood acronyms and abbreviations to minimize misinterpretations or errors. And you have to know that there are specific medical abbreviations, not common abbreviations that we use. Make sure that it's recognized in the medical world. The Joint Commission and Institute for Safe Medication Practices are considered the two authorities on abbreviations and provide a do not use list. When you use an abbreviation, you pronounce each letter of the abbreviation separately and distinctly. For the acronym EMT, you say EMT. When you use an acronym, you are shortening several words, usually using the first letter of each word to make the acronym. Acronyms can be pronounced as their own words. So sample history is just pronounced like the word sample by reading one of the letters. So EMS pronounced EMS. Or as a combination of the two. So DCAT BTLS is an example of that. Misunderstanding and errors occur if someone involved in the patient care does not understand the meaning of abbreviations or acronyms. For this reason, some agencies just don't even want you to use abbreviations or acronyms if you don't have to. Abbreviations take place of words to shorten notes or documentation. Remember to use only standard accepted abbreviations to avoid confusion and errors. Be familiar with accepted use of abbreviations in your local jurisdiction or service area. Symbols, like abbreviation symbols, are sometimes used as a shortcut in communication and documentation. As with abbreviations, it's important to use only symbols that are widely understood. And there is a reference list of common word roots, combining forms, prefixes, suffixes, and abbreviations in your book. Make sure that you go through and look at those and try to understand them as best as you can. If you have questions, make sure that you ask me or ask somebody, because this is going to be a huge foundation for going forward. They're not going to give you the meanings of all of the words anymore. It's going to be kind of up to you to figure it out a little bit. So a lot of work on your part will pay off. And this is something that you can use in a medical career going forward. That's it for Chapter 5.